Cerebral Palsy by Andy Octo. Before I start this slideshow, I would like to add that these two pictures here are pictures of my brother. He is 25 now and was diagnosed with cerebral palsy at the age of 2. You will see more pics of him, younger and older, throughout my presentation. According to Medical News Today, cerebral palsy is a term which encompasses a set of neurological conditions that causes physical disability in human development that affect the brain and nervous system. Cerebral refers to the brain, while palsy refers to the lack of muscle, causing problems with physical skills along with motor skills. This is a condition that will not worsen over time. According to CDC.gov, CP is the most common motor disability in childhood. CDC estimates that an average of 1 in 303 children in the U.S. have CP. There are 3 types of cerebral palsy. First, I'm going to talk about spastic cerebral palsy. The muscle tone in spastic cerebral palsy is increased. It also has increased deep tendon reflex, impaired motor coordination, and muscle weakness. Often is a result of damage to white matter, but might be gray matter as well. It can range from mild to very severe. Mild being few limitations to severe being many limitations to where their arms and legs are useless. It might affect muscles in the face, causing not being able to talk, can affect chewing and swallowing, and even eye movement. It can also affect joint movements and can be very painful. The next type of cerebral palsy I'm going to talk about is called dyskinetic cerebral palsy. It includes 3 types within itself. The first type is ataxic cerebral palsy. Ataxic cerebral palsy is a rare form of CP affecting 4 to 5% of children with cerebral palsy, according to MedicineNet.com. It includes a loss of muscle coordination and motor skills are greatly affected. The next type that dyskinetic cerebral palsy includes is diatonic CP. It involves slow movements, unusual postures that muscles won't relax for minutes or seconds, and muscles are normally increased. The last type of dyskinetic CP is cranioptoid cerebral palsy, also known as athetoid cerebral palsy. It consists of uncontrollable movements, tensing up when stressed or when reaching for something, involuntary movements in the legs, trunk, or face. It has a decrease in muscle tone, can affect muscles in the face, such as expressions, swallowing, and eating. It also has a large effect on the motor skills. The third type of cerebral palsy is hypotonic cerebral palsy. It includes diminished muscle tone. The person might appear floppy, and you can see early symptoms such as a baby don't gain head control and lift their head around the age that they are supposed to. According to MedicineNet.com, it is believed that hypotonic cerebral palsy is the result of an injury or malformation at an earlier brain developmental stage that which causes spastic or cranioptoid cerebral palsy. Some types of cerebral palsy might have a mixture of the 3 types. Signs and symptoms. The signs usually start to appear anywhere between the ages 0 and 3. Crawling, walking, and speaking might not develop at the normal age if developed at all. They might favor one side of their body and might even notice slouching while sitting. You might notice stiff and floppy muscles and joints. They might have issues with hearing and eyesight. They might have seizures and limited movement. They might not be able to control their bladder or their bowel movements, and they might be easily startled. In this picture here, you can see my brother slouching and kind of favoring his left side. In his left hand, you can also see is kind of floppy. Treatment. People with cerebral palsy will have many problems. It cannot be cured, but to get better, the patients need to regularly see a physician, a physical therapist for their muscles and joints, an occupational therapist for their motor skills, a speech therapist to help with their speech, an orthopedic surgeon which specializes in bones and joints, a neurologist who specializes on disorders dealing with nerves, and also an eye doctor. The cause. According to MedicineNet.com, despite the diversity of causes of cerebral palsy, many cases remain without a defined cause. It normally happens in the prenatal stage and is caused by premature births, which can cause bleeding to the brain. It also can cause respiratory distress due to poor developed lungs, which can cause a lack of oxygen to the brain and can damage it. Abnormalities of the white matter has been noticed in most cases too. It can also be caused by genetic disorder, strokes, and infections to the brain. Accidents within the baby and infant stages where brain damage might occur can also be a cause, such as child abuse in infants and babies. Prevention. There are some things people can do to minimize the risk. However, in many cases, cerebral palsy cannot be prevented, according to medicalnewstoday.com. While pregnant, a woman should not drink nor smoke, go to her regular appointments, eat healthy, keep up with all of her vaccines, and exercise regularly.